This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what is hip dysplasia. If you like this video, we put out new content weekly, so please like and subscribe. So hip dysplasia basically means that with your hip you have your ball and socket, and hip dysplasia basically means that the socket is not quite a full socket. It could be too shallow, it could be sort of faced the wrong way. That's what hip dysplasia is. And the problem with that is the ball then can't really sit quite normally and can kind of move around. Now, this is a congenital thing, meaning that you're born with it. So sometimes kids are born with their socket not quite right, and what you'll find is that their hip is actually dislocated when they're little babies. Normally seen in females, firstborn and left hip, just the way the anatomy is. I know it sounds strange that it's just more on the left than on the right, but it's just based on how the baby sits when they're in their mom's uterus. So that's generally what it is. If you do nothing, these kids will still be able to walk okay and everything like that, but they end up getting early arthritis and end up sometimes having back problems later on because their hip's not in their socket. So this is something that's normally tested for when the baby is young. And if the hip is out of socket or it's not quite right, they'll put the baby in something called a Pavlik harness, which is a little harness that they wear. That can only be done if they're usually under 6 months. Once they're over 6 months, then you kind of get into like casting, where you have to go into the OR and make sure the hip's back in place, and you can cast it. And to tell if the hip's dislocated in a baby that young, they usually use ultrasound, works pretty well. As you get older, the things that worked as a baby to get the hip back in the socket don't really work quite as well. And so you end up having to escalate what you do. So the idea is that when you get the ball back in the socket, it allows the socket, as when they're little, to kind of form properly around it, so that they end up getting rid of the hip dysplasia. But as you get older, that ability to form around it isn't as good. So like in a baby, you can get away with a little harness or a hip spica cast. When someone gets older, you actually have to make an incision to get the hip back in the socket. The longer it's been out, the longer it is to get it back. And then once you're fully grown, none of that stuff will really work anymore. So what some surgeons will do is they'll do something called a periacetabular osteotomy. There's different types, that's a specific one. But basically what they are is they're actually changing the shape of the socket surgically and putting the hip back in. So when someone gets to skeletally mature, or they're an adult, or even if they're just like a teenager, that's sort of the only option you're left with. It's even done sometimes in adults. They'll find that they have hip pain, and then they've had hip dysplasia their whole life. It wasn't enough that their hip dislocated as their kid, but it's enough that it's causing them problems as adults. And then they'll sort of get these surgeries, and there's not too many types of docs that do these. Usually just hip specialists that do it, and not even the ones that do hip replacements. Usually it's like they'll do like hip scopes and hip osteotomies. Not a super commonly done surgery, and not too many surgeons that actually do it. But essentially, yeah, that's what hip dysplasia is. The socket didn't form quite right, and the goal is to get the ball back in the socket. The earlier you can do it, the less you have to do with it. As someone gets older, then you have to do surgery. So if you have any questions, if you like this video, I put out new content weekly, so like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below. But I can't give you any specific medical advice about your condition over YouTube. Because this video and all my videos are for educational purposes only.